was gonna be free, I'd have to change my name. Mama, don't feel shame. My old name was all wrong. I've waited for so long to decide my destiny.
In 2021, Washington introduced a temporary law enabling international medical graduates, known as IMGs, to practice and serve their communities. Now set to expire in 2025, thousands face uncertainty once again.
Honestly, it is a national security issue, the fact that we don't have enough doctors.
This is our journey for a lasting change, a fight for justice and opportunity.
If these healthcare providers were good enough to do it during the pandemic, well, they should be good enough to do it now.
This is our story.
SeaTac City Council member Amina Ahmed, who was killed over the weekend in a head-on collision.
A fight for recognition, justice, and a better future for international medical graduates and the communities they serve.
I don't want to cry.
My name is Dr. Mohammed Khalif, Executive Director of the International Medical Graduates Academy. In 2017, alongside a dedicated group of international medical graduates in Washington State, I embarked on a journey to find a way for international medical graduates to practice in the United States. But before we delve into that story, let me tell you about myself. Although I came to this country at the age of 3, I became an IMG. You might be wondering how. How did that happen? My story began in East Africa. I was born in Mogadishu, Somalia in 1990. A year later, a civil war erupted.
A difficult and bloody civil war in Somalia led to the overthrow of the Siad Barre,
forcing my family to flee to a refugee camp in neighboring Kenya. We were fortunate to resettle in the United States in 1993. But because my father was a businessman, my childhood was spent living across different countries, Dubai, Pakistan, and Somalia, before pursuing a medical degree in China, where I spent 6 years of my life. Upon graduating, I could have worked as a doctor in many other countries, but I chose to return to the US, my home. When I returned, I believed my qualifications would be enough. Instead, I faced a system that did not recognize the potential of international medical graduates. I applied to hundreds of jobs but was consistently rejected, told I either needed more experience or that I was overqualified. I couldn't even secure a position as an EKG technician, and ended up working as a security guard. It was one of the darkest periods of my life. A doctor, standing watch over cars, chased by dogs and homeless people. Many might ask, why not leave? To be honest, I did consider it, but I wanted to stay and serve my community here in the US. My first step was seeking help at Highline College, where staff were surprised by my situation, wondering how I ended up as an international medical graduate. They eventually pointed me in the right direction. But after spending nearly $30,000,
medical school tuition is hugely expensive and requires students to get big loans.
The time it takes to prepare for those tests and the cost it takes is prohibitive. Okay, once you pass those tests, you have to get into a residency slot. There are not enough residency slots, which is crazy.
With no hope, I reached out to Dr. Ahmed Ali, Executive Director of the Somali Health Board.
I was able to connect with Dr. Mohammed Khalif and several other individuals. At that time, I probably would say about 20 to 30 individuals who walked into our offices asking for us to connect them with residency programs, an opportunity to work with some of the clinics here in the state of Washington. Unfortunately, because of the way the system is set up, many of them had difficulties.
From the Association of Medical Colleges suggests there could be a shortage of up to 120,000 physicians in the U.S. by the year 2030.
You might wonder how the IMG issue started.
In a few moments, I will sign into law the first balanced budget in a generation.
It traces back to the Balanced Budget Act of 1997, a federal bill aimed at controlling costs.
I do believe those cuts were justified. The biggest driver in the federal deficit is healthcare costs. Beyond any shadow of doubt, healthcare costs have exploded.
This legislation unintentionally imposed strict limits on residency positions, restricting opportunities for international medical graduates.
Because always keep this statistic in mind. The United States of America spends more money on healthcare on a per capita basis than any other country in the world. And it's not even really close.
It started in 96, 97, and in the early 2000s it really hadn't been felt entirely, at least not by the population. So it was being felt by the medical schools, it was being felt by the GME groups.
These caps on residency slots have created long-standing obstacles for international medical graduates, and the consequences of the policy decision continue to impact the healthcare landscape even today.
Fiscal responsibility is an important issue. We are currently running a massive debt and a massive deficit, which impedes our ability to meet the needs right now, today, that we already have.
This is in relation to already existing legislations in the books, whether it's federal or the state, that hinders talented individuals, folks who have been practicing medicine across the globe, who are here in the United States.
Honestly, it is a national security issue, the fact that we don't have enough doctors.
There was another significant challenge: organizations and healthcare institutions that opposed the IMG cause, fearing it would lower the quality of healthcare. We refer to them as the gatekeepers.
The residency program manager clearly tells us in a meeting where we had several people sitting there, says, I don't think I can have any international medical graduates because these people are not highly trained, they don't speak English well, and our institution will not recognize them.
There was a general hesitancy to create alternative pathways for international medical graduates, as some stakeholders were concerned about maintaining standards and protecting the existing professional interest.
That belief that somehow medical doctors from other countries are less qualified for some reason or received an inferior education is just built on a faulty assumption. It's a racist stereotype that works its way into unfortunately, into the hearts and souls of many gatekeepers.
Faced with disappointment, Dr. Ali pointed out that the challenges we encountered were deeply systemic and needed to be addressed through legislation. He urged me to unite with other IMGs in Washington to push for meaningful change.
We realize this is an institution-related matter. It's a legislative-related issue that we really need to address.
Recognizing that change required unity, we formed the Washington Academy for International Medical Graduates, known today as TIMGA, to confront these systemic barriers.
I remember someone told me, hey, there's people are starting this group. The big group we first met was Capitol Hill Library.
I've heard about the group for international medical graduates here in Washington State.
I just remember that they were very well-spoken. They were very eager to be able to find a pathway so that they could use their professional training and help in communities.
People were ready to fight for having more opportunities for international doctors, and that was great. I was so lucky to find you.
Real change required more than just our dedication. It needed the support of lawmakers.
So I first heard about the issue of the international medical graduates from you, Dr. Khalif, and from Abdi of the Somali Health Board. You guys both brought this issue to me and made me aware of how many international medical graduates live in our own state that have incredible expertise and experiences and language and are not able to practice.
I first heard about it at Highline Community College, which is in the 33rd District and is really the most diverse community college in our state. We have a huge population of immigrant students, and they were there because they couldn't get their credentials accepted in our country.
I became aware of this issue several years ago, actually when I was first a member of the State House of Representatives here in Washington State, where yourself and some community interest groups came to me and talked about the urgency and need, of course, of not only bringing more medical professions into Washington State, in particular doctors.
Our journey was filled with long nights, but every step was driven by our passion to make a difference in healthcare.
It did feel like we had to keep each other motivated and afloat and our heads up. It was a kind of more darker times for our group.
We worked together as a group to find the people that could help support us.
What I remember is, first of all, our meetings, the group slowly getting bigger each time we meet. And I remember our first meeting was, my friend Lois, that she put together like Senator Kaiser, if I remember right. And that was our first meeting with elected officials.
And we ended up connecting with Karen Kaiser, who was a state senator who was also interested in this, because these were fully qualified medical professionals.
We were working with the college, and we were able to create something called a welcome center where immigrant students could get help getting their credentials accepted and moved.
And then what Mohammed did was also he contacted for Somali Health Board. And Somali Health Board introduced us Senator Saldana.
Coming up and speaking with me and telling me your story. My name is Rebecca Saldana.
I do recall clearly having an event which was organized by Mohammed Khalif and Somali Health Board and other individuals that brought together the legislatures, and they saw with their own eyes that these individuals are highly trained. They speak English fluently. There's no difference between them and someone who graduated from some of the institutions that are here.
The whole world really was in that room and sharing their stories of how they had to leave their countries and come here. I remember one story in particular.
About the woman, I believe she was from East Africa.
And she told the story of being able to give birth, and as a doctor with one of her patients, and then to meet this patient here in Seattle.
But she looked at the medical interpreter and thought she was her doctor because it was the same person who had delivered her first child in Africa. And she was working not as a doctor or nurse, but as a medical interpreter.
And while that was a huge relief to be able to have, continuity with the same person, the fact that she wasn't able to actually practice.
That particular situation that the Senator Rebecca Saldana is referring to is a clear indication that there's something wrong with the system, and we had to make that change.
And that's the kind of thing that we can correct and we can make better.
Passing this bill was anything but simple.
I remember one day we went 11, and by the time we were sitting there, it was 7 or p.m. or it was exhausting. It's not easy. It's not like something that you go there and then boom, you're done.
It was a very challenging legislative process.
We faced skepticism, pushback, and a system that often saw us as outsiders.
In Colorado, we saw that there would be, on average, about 30 unused slots for residency programs across varying medical physician specialties. The biggest response we heard from them was, you are taking opportunities away from American-trained physicians, and really what they were really saying was, this is reverse racism, right? You are trying to prioritize IMGs over American-trained individuals, when we really weren't, right? These were unused slots.
And for us not quitting and not, keep going and also showing them, what we are capable of, and that this is something that needs to be done.
So those conversations led to more conversations with our elected officials.
Minnesota had a similar IMG program, and we presented a comparable idea to the legislature. Members of the committee, thank you very much for hearing this bill. My name is Dr. Mohammed Khalif, and I'm one of the international medical graduates in Washington State.
I think that was the first kind of hurdle, was to figure out like how to take your passion, and the fact that Minnesota had done something, gave me the entry to be like, well, if Minnesota did it, so why wouldn't we be able in Washington to be able to do something?
I think my first recollection was about the Minnesota model was, does it work?
The Minnesota model was very unique and was proven to actually be helpful in the state of Minnesota.
If you can steal something from another state that's working, go ahead and do it, because you don't need to convince legislators that it's going to work if it's already in existence in another state.
If we think that it's working for one state and it's doing great work in advancing the health disparities of those communities impacted, we didn't see a problem here in the state of Washington.
Listening to what the agencies were saying, and then being able to work with our policy staff to figure out how do we at least structure in a way, because for me, sometimes there's not a clear pathway.
However, it was blocked after testimony from the Medical Association and numerous other groups.
The word stakeholders was used multiple times by the big institutions, whether it's the University, Washington School of Medicine, or certain hospitals, implying that they are the stakeholders and we're not.
There is like sometimes a little bit of discouragement is going to happen, and when you're having all these meetings and nothing is coming, and you see like, there's a lot of organizations that didn't want these IMG doctors to succeed, whatever. Those, I don't want to mention it, and we have a hard time, and some of them just looking down on us.
The initial bill faced significant challenges as the gatekeepers tried to obstruct its progress.
We had certain institutions that threatened to kill the bill simply because it was not advantage to the way they were accustomed to. So they're always operating whereby, hey, we make the decisions and we are the ones who are going to determine what the language looks like in the bill, and if we don't like it, we're going to kill the bill.
First of all, they were surprised that we are there. First of all, so they were surprised that we are there, and we are capable, and we are fighting with them also. Not really fighting, but challenging them, challenging the system,
This bill is here to help solve many of these problems. This bill will support the international medical graduates that already live here in obtaining a full US license, and steer these highly qualified doctors directly to the areas that need them most.
There were some pretty vocal opponents, and so that's, you deal with adversity and opposition as part of this job. It's just what you do. But there are times when you get frustrated because it doesn't seem like it's as big a deal as people are making it.
Eventually, Senator Saldana proposed an alternative solution, a work group involving all stakeholders.
Where I really thought about for the work group was that it's important to make sure that we're building trust. Because what I saw is that there are a lot of distrust from IMG that the medical institutions would ever take them seriously or create a pathway, but also I think really the resistance was not that they didn't want to, but that they really felt that they didn't know how. So I think part of it was like how to build trust.
That didn't settle well with us. I mean, we had multiple group discussions. The Minnesota model was very unique and was proven to actually be helpful in the state of Minnesota.
Yet, it was another setback and a source of deep disappointment.
I think there were some conversations you and I had where we said, look, this is nice, but there's more work we got to do. And so it became a holistic look at the whole issue of IMGs and how are we supposed to get them integrated into the healthcare system in Washington.
In hindsight, Micah's suggestion had merit. Instead of focusing solely on residency, we could create various licensing pathways.
As much as we've got some, some supporters in the legislature, as soon as you take away that whole, oh yeah, we did get them in the healthcare workforce, but they're in Oregon or they're in Idaho or Wyoming now, which, more power to them going there. That's not what the legislature is interested in funding is an export service.
Senator Saldana also supported the potential of this approach.
What I had heard in other places is like they'll put it on the bill, they'll make something look nice, but then it just gets dust on the shelf and it doesn't actually become real in the lives of the IMGs or also our communities.
Unfortunately, we didn't see eye to eye with the individuals who at that point had much more impact in Olympia, and that led for us to work with them closely to make sure that the bill doesn't completely die, but to go back and revisit some of the language that was in the bill.
We suffered a devastating loss. Amina Ahmed.
SeaTac City Council member Amina Ahmed, who was killed over the weekend in a head-on collision.
Our strongest advocate and the first Somali American to serve on the SeaTac City Council, tragically passed away in a car accident.
We stopped at the side of the road and we just cried.
What I remember is just how unfair life is.
At the time of her death, Amina was preparing to meet with me and my colleagues, Lois and Anab.
So we had a meeting at 1 p.m. Me, Mohammed, and Lois was there waiting for her.
We waited for her at Starbucks and she didn't return. And then we didn't hear until later in that day from Khalid that she had passed.
I just went a corner and just cry, and yeah, it was very shocking.
So if we could all stand for a moment and just have some happy thoughts of Amina.
Her passing sent shockwaves through our community, marking one of the most heartbreaking moments in our journey.
It was devastating to the whole community, and specifically the IMG task force.
So it's time that needs to be recognized. I'm working right now on the same issue under manufacturing.
She brought a voice and a commitment and a power to the way that she engaged community providers and community organizers.
Well, I think Amina understood that the struggle for immigrant and refugee workers is a struggle for all of us.
I have been lucky enough to work with late Councilmember Amina Ahmed, who was a passionate advocate of the community.
Though Amina was no longer with us, her spirit drove us forward.
It was such a huge gap to lose her knowledge, her presence, her community organizing, and her commitment to the communities that she was working with.
So Mohammed was the initiative guy, who said that we need to honor her, and a lot of us we agreed with him and honored her and to continue with Amina's legacy. So we have to show that we can do this, because it would be disappointing with Amina if we wouldn't go ahead, if we weren't moving forward.
In her honor, we pressed on, leading to the passage of a temporary bill, a testament to resilience and determination. How do you think Mama Amina Ahmed would feel today?
She would be very proud of all the work that's happened. She would be very happy that providers are being enabled to help communities in need. That was her biggest ask of anybody that she worked with, was I need you to help our communities so that they can move forward, they can thrive, and they have the services and the pathways to get to where they need to be.
Through her connections and her efforts, I think in a short period of time which I worked with her on this effort, was able to connect me with many legislatures.
I don't think without her giving us a direction, I don't think we will be here. This TIMGA wouldn't be becoming this big today.
I don't remember if I talked to you about it or not, but I got a meeting with Chair Cody. 2 months later, I get a text from one of my staff. He's like, hey, guess what's in the legislature right now? And I was like, darn, wonder how that happened. And so, I didn't know she was going to run with it, but I think she had. I swear it was at the time Rep. Valdez.
Yeah, we were pushing both of them.
As Washington State is becoming more and more diverse, it was really important that we find more doctors in our state to help serve patients who have that need, that they're looking for doctors who, of course, can understand them culturally, but also look like them and can speak their language.
After a long struggle in countless sessions, we finally achieved victory in 2021, a temporary bill that was signed into law, allowing IMGs to work in Washington State.
Tremendous talent and all it's going to do for our state. And I'm happy.
I remember when it was passed, we were watching it, the votes, and we were monitoring very closely.
First of all, if we didn't have the support of a lot of senators and House representatives, I don't think our things would be passed.
Even though I was the first one to introduce the legislation, that first year, everyone in the health community, like all the members of the health committee in the Senate, were super excited about it. When it came to the floor, people were excited.
By opening that door and opening the conversations up on all different issues, but on this one in particular, where we were able to make such good progress over the last few years, I'm just thrilled to see this. It makes so much progress to our people.
Our happiness that day was beyond words.
And there's a big picture, I don't know if you see that, it's a beautiful picture. And when we went there and everybody was, and the government was signing the bill, and we were like excited. We didn't know where we were exactly. It was amazing.
Representatives and senators that understood this bill, they understood the impact that this legislation will have.
With the bill passed, TIMGA quickly set out to make an impact, connecting IMG doctors with clinics across Washington, bringing essential healthcare services to communities in need. Our journey across Washington highlighted the profound impact of IMG doctors in diverse communities, from rural clinics to cities.
We know that there is an extreme shortage of bringing folks into the medical profession, into our clinics, into our hospitals.
It's severe in many rural areas especially, and so that's where we have some real challenges to make sure that folks who are in places that aren't big cities have access to healthcare professionals and services.
And so we were able to match this group of international physicians who wanted to find work with that need in rural communities and in underserved communities. And I think it was just, I like to say, a match made in heaven.
Today, we're traveling to Yakima to visit an IMG doctor whom TIMGA connected with the Yakima Union Gospel Mission Clinic, providing essential medical care to rural areas with limited access.
Good. Nice to meet you.
Nice to meet you too.
Here at the YUGM Care Center, we're a great spot for IMG providers.
It's a very good opportunity for the patients to have us working here. And it's a very good opportunity for IMGs to be able to work and help the community. It's both ways win.
I mean, they have more experience than most of us, right? Who started here and are able to get all of the get all the way through without having to stop and have a break.
Providing culturally appropriate care to underserved communities highlights the profound impact of this license in bridging critical healthcare gaps.
I think it's better when a patient and a doctor is in a room, just them. That way they could connect better, and then they could have more privacy other than just having an interpreter.
Well, since the beginning, sometimes I have like a one appointment very long because they start like up and up. They feel like they can talk to me like freely because I was speaking Spanish.
Sometimes she's even double booked. Sometimes she's even triple booked. And we asked her, is that okay? And Dr. Diaz like, yeah, like I don't want nobody to be left without an appointment, so just book me in. So
there was somebody who had been screened that was sent to us, as Dr. Diaz has accomplished literally her lifetime goal of getting into residency and to be able to finish with a licensed MD. So she's moving on for this great purpose, and so we have this spot to fill and looking for any provider, and yet then there is an IMG because TIMGA said, hey, I actually have this applicant and this would be great for her, she would be a great fit. And so she applied and she will be starting this week or next. And so she's actually going to be filling that space once Dr. Diaz leaves.
This seems like a critical program that we need to continue. And the people of Yakima desperately and deserve to have good health care.
Next, we traveled to Puyallup, where legislatures witnessed firsthand the dedication of IMG doctors, reshaping perceptions and demonstrating their essential role.
For us, for our clinic, Dr. Omar is extremely valuable. I cannot see all these patients by myself. If it wasn't for Dr. Omar helping me, it's literally drug.
So today's meeting, we're looking at the clinic here and the benefits that they've been having with bringing international medical graduates into the clinic and finally being able to practice and see patients.
0 to 100%. Because when I came here to USA 6 years ago,
Today we're here at the clinic meeting a lot of good doctors and people talking about international medical graduates and the process that it takes to get them certified so they can actually be a provider of health care to people all across our state.
So we have a shortage of medical providers all across the state. That includes Pierce County. And when we are able to fill that system and that pipeline with more providers that can provide direct patient access, then more patients are able to get the access to medical care sooner rather than later.
The patient has to pay way more in deductible and fees and this and that than.
This license expires in just a little while, so we've got to extend that time period that this license can be in effect.
First of all, I gotta say it was a great meeting. Very positive, very optimistic, and it turned out just as I hoped it would be. Senator Gildon and Representative Chambers, they came. They saw Dr. Omar Abdul Maqsood and his passion. How he was treating patients. He visited us a little bit late, because he was spending extra time with the patient. Pacific Medical Specialties Clinic is one of the few healthcare facilities in Washington employing a significant number of international medical graduates.
So it was hard for me to find any opportunities at all. I didn't even dream to actually work as a physician.
Gathered here are a group of IMG doctors reflecting on their journeys, sharing both their struggles and triumphs.
And I came from this year. I don't want to cry. I came from this year, since July, as a medical technologist in a virology lab, which I love. This is in UW, I love it. But from a medical technologist to a physician in a month. I'm a provider in a month, I'm a PCP in a month. And a year after, I'm a medical director. And I still cannot believe it. Sorry, I'm a very emotional person.
Again, growing alongside, I would say, my family here, seeing how everyone has brought such a unique flavor, to medicine in our group.
Immigrant doctors and nurses with those skill sets could be a huge part of making sure we have an adequate healthcare system.
Many were once esteemed doctors and general surgeons who were relegated to the most basic roles in the healthcare system.
When I came to this country, I was already a general surgeon and a facial plastic reconstruction surgeon.
For how many years?
I practiced for 15 years.
Wow.
15 years before?
15 years before I came here.
I can't tell you how often I hear, even with the legislation in Illinois, from partner organizations that work in the migration space, are these doctors really good enough to serve in the United States?
Many of them have certain skills that are even more advanced than the medically trained providers here.
So the first answer is yes, these physicians are good enough. They still have to be tried and tested. And they're only getting on the hospital floor if they pass the quality test that we have in the United States.
And now we can see the fruit of that opportunity that we advance for our community.
I mean, after pausing 5 years of practicing, when I get my white coat, my stethoscope, it feels like resuming my previous job.
So when I got this opportunity, it's like completely changed the life of mine. And I was joking to a couple of my fellow friends, like, even if I'm dying, if someone says that patient needs you, probably I'll postpone my death and I come back and treat the patient,
So much like this, we've all hungered and achieved and overcome red tape after red tape after red tape of exam, hurdle. It's the person that you would want on your team the most, I think, is that the person who's experienced the most hardship and most setbacks and still had the desire to get back up.
I'm really thankful to Dr. Mohammed for working this hard to bring all of us on the board, and this is a real changing transformation in our lives, as well as I can confidently say it's a transformation change for even patients that we are serving.
We have 4 amazing owners, Dr. Min, Brenda Evans, Dr. Fleming, and Waymani. And these are just 4 open-minded, genuinely very talented in their own fields people who were able to see talent behind our unusual credentials.
Thank you so much for this opportunity. Thank you.
In North Bend, IMG doctors have made a lasting impact.
And what kind of patients do you see in this facility?
It's mixed. We have geriatric, long-term care, short-term care, Medicare, HMO, therapy, IV therapy, physical therapy. She'll see anywhere from 11 to 14 patients, whether it's long-term care visit or the quarterly or new patient.
Our fight for recognition is not just for ourselves, but for every patient in need.
We have a lot of people experienced homelessness prior to their recent hospitalization. That's how they end up in our facilities sometimes.
By filling critical gaps in underserved communities, IMGs are strengthening healthcare across the state, bridging care to those who need it the most.
It's been a great advantage for us having Dr. Nestorango. Communication is awesome. Getting to know and to learn how she provides care, how she communicates, how the patient's care is met, regardless of where higher education has been. It's been awesome.
The challenges faced by IMGs extend beyond Washington State, taking our mission nationwide. Today, we travel to New York for the IMG event, where over 1,500 international medical graduates gathered to share their experiences and hopes.
Work towards, and so in Washington, we've been very successful in this pathway. We have passed our legislation law in 2021, and in just 2 years, we've gotten at least 70 doctors in practice every year.
I'm Dr. Sebastian Rorana. I'm the founder and CEO of Project IMG and the IMG event. This one was the 4th annual IMG event in New York City. We have more than 1,200 attendees.
This is maybe one of the largest IMG crowd I've been around. And it just shows you the need of our community for these doctors.
My journey as an IMG has been challenging. We've had some ups and downs, but we're here, we're strong, dusted ourselves off.
As IMG, I understand that we have to go through a lot. We are grateful for TIMGA that they are helping and they are working for the IMGs. We are very happy with you. We are very happy with TIMGA. If it wasn't from you guys, these kind of events wouldn't be happening.
The gathering in New York was more than just an event. It was a testament to the strength and unity of international medical graduates fighting for recognition.
We have some breaking health news as we learn of the very first case of the coronavirus here in the U.S.
The World Health Organization declared COVID-19 a global pandemic.
The impact of international medical graduates on American healthcare was unmistakably highlighted during the COVID-19 pandemic.
It's pretty emotional. It's pretty emotional. COVID hit all of us pretty hard, and it hit the state of Illinois and Chicago and big cities really hard. And there were so many physicians who were just not able to cope, and there were not enough physicians.
And back here at home, a new report from the Inspector General for the Department of Health and Human Services finds a U.S. health system under extreme strain, plagued by shortages and burned out medical professionals.
That really highlighted the shortage of medical staff we had. Colorado was really struggling in our response to COVID, and in partnership with the governor, we were able to create a temporary pathway for IMGs to serve within Colorado during COVID.
As they stood on the front lines, risking their lives to serve their communities despite systemic barriers.
We really saw during COVID that we had physicians who were willing to raise up their hands, and they were watching people suffer in their communities, and they could do nothing about it. I had an Ethiopian physician on the phone, and she was crying because she said, I took an oath. I took an oath, and I can't do anything. We had physicians who were volunteering to be COVID testers because that was all they could get. In New York, they had a call for volunteers in New York City.
But we found even before the outbreak, New York State had a shortage of medical professionals.
For people who were retired physicians, people who had just graduated, now you can work in the hospital. Our community was not allowed to volunteer. We had people raise up their hands and try to volunteer, and they said no.
These doctors went above and beyond. They didn't just fight the virus, they fought against systemic indifference, proving they belong in every conversation about our healthcare future.
Then, as soon as that executive order ended at the end of the year or whenever it was, they were no longer able to practice, and they sacrificed their lives and they put themselves at risk, and then we're told, thank you for your service, have a great life.
You get your chance, and then to be said you have to start from scratch and you have to start from bottom all over again. That's devastating.
There's a long history of people of color being put into situations and workplaces that are unsafe.
Certain populations are seen only when they're needed and discarded afterwards.
The reality is immigrants are often seen as an extractive resource, and we're only allowed an open door when we're particularly needed. But the reality is this country is built on immigrants.
Let's go back now and take the lessons that we've learned under COVID about the value of IMGs in the US healthcare environment and create a structure like you created in Washington to create a permanent pathway in legislation, in the law, not in emergency.
It helped people realize that we do have an alternative, and other states were doing the same thing with their policies and saw success during COVID of all these immigrants who are willing to step up and put their lives in danger to save other people because they're that passionate about their work.
If these healthcare providers were good enough to do it during the pandemic, well, they should be good enough to do it now.
The success of TIMGA in Washington has become a model for other states.
Other states at the IMG was like, they were thrilled. I said, how did they do this? Oh my God, why we cannot do this,
Because Washington State has shown the way, we can persuade other states to follow.
And I cannot emphasize the founders of the TIMGA and also the board members, specifically Mohammed. I have to give him a big time credit because his commitment and dedication, that's why where we are today.
Leaders from other states, inspired by our progress, are exploring similar pathways to support IMGs in their regions.
No one even thought that it was possible to do. Mohammed pulled it off. So of course everybody wanted to know, how did Mohammed do this? And how do we do it in as many other states as possible?
Before we started looking at IMG work, we started to identify what states had been successful in their IMG policies. And Washington was one of the places we saw that had successfully moved forward with IMG policy and were at the time on the path to pass some incredible work. And so through our partner organizations, we were able to connect with Mohammed and learn from him and all the great work they were doing in Washington.
And so that's how we leveraged TIMGA to be able to help support us in the state of Illinois. And I'm happy to say that in 2025, we will start having internationally trained doctors working alongside US trained doctors in the state of Illinois.
Our journey isn't over, but the influence of TIMGA is already being felt beyond Washington's border, sparking hope and laying the path for IMGs nationwide.
On one side, you've got Illinois, which TIMGA and Wes are working together on the rule implementation with UPCLO, who passed basically a shell piece of legislation that said you shall create a pathway and it shall lead to permanence, but no real details. So all those details have to be done in regulation, which takes time. Most other states, and we're working with Virginia and Wisconsin and a whole host of states that are now in the implementation phase, their legislation was more robust, more detailed. So the regulations that have to be implemented are going to be easier to do.
You know, as you see more and more states pass this, it's going to then put pressure at the federal level. And I think as we get more and more representatives who understand this issue and understand that the cost of healthcare is crippling America, and as we continue to explore options on how do we reduce costs, IMGs are a perfect solution.
We hope that you look at that and figure out what are the steps that you can take in your state to be able to benefit, because it's a win-win-win.
This journey and the fight for international medical graduates would not have been possible without the support of our partners.
World Education Services is a 50-year-old global organization dedicated to the success and the inclusion of international students, immigrants, and refugees.
A lot of that work has focused on implementing inclusive pathways to occupational licensure, specifically in healthcare occupations with a significant focus on physicians.
World Education Services, a key ally, has played an instrumental role in advancing TIMGA's mission.
The Welcome Back Center in Washington State connected us with Dr. Khalif, who had already achieved a great accomplishment of moving forward temporary orders in the state of Washington for international medical graduates to work in their professions.
Watching with eagerness as Mohammed shepherded that bill through. We have since worked with Mohammed in a number of other states on creating alternative pathways. He's a real leader in this area.
We were privileged to be connected to Dr. Khalif during the COVID pandemic. We were actively moving forward WES initiatives in a number of states focused on emergency orders for international medical graduates to practice.
Kudos to Washington not only for passing it first, but for being the only state so far that's issued licenses and touched people's lives.
It was a historic achievement in Washington State by Dr. Khalif. It became a model and motivation and inspiration for many people around the country. We're working with international medical graduates on preparing them for the licensing process. We are also working closely with employers to tap the talent that is available in the immigrant community. We also conduct research and surveys and develop reports and policy briefs that are essential for moving the field forward.
Today, TIMGA has connected over 40 IMG doctors to clinics and healthcare facilities, collectively serving 35,000 patients each year.
35,000? 35,000. I think that's pretty great.
that makes me feel wonderful because, you know, when we passed the bill, we didn't know, I mean, how many patients were going to be served.
How does that make you feel, like knowing that like a policy that, you know, you wrote in a piece of paper, or, you know, communities wrote together, now actually literally changing lives and saving lives? How does that make you feel?
It makes me feel so humble and really, really grateful. Yeah, thank you.
We're lucky to be in a position whereby we can say that number of international medical graduates are now practicing. Over 35,000 patients are being served by international medical graduates.
I'm thrilled with the progress, absolutely thrilled. To know that those 35,000 patients have gotten good care from good professionals that might not have been available to them, that means there's healthier people, people who have avoided really serious harm, and we're all better for it.
But I'm also taken aback in the sense that we have to go back to the same process over again.
The law is set to expire in 2025. Without further action, our progress will be lost.
Let's imagine that we have physicians under MDC license who finished their 4 years. So they are already seeing patients on their own for 4 years. It's longer than any residency that we have. Yeah. So what is the reason to lose them at that point?
Our journey continues as we remain hopeful for the passage of a permanent bill in Washington and other states.
Should IMGs be permanent, and should there be pathways for them to become permanent? Absolutely.
I want to make sure that it's permanent, and the state of Washington, as has always been, should be the leader in the United States in international medical graduate efforts. It should be an example that other states look at and look up to the state of Washington.
This bill that would be introduced next time, you know, would be a simple bill, right? You're just removing the expiration, and you're removing it from a pilot and making it a permanent program.
The process that you have to go through to reapply as being a physician. So you could go through that whole process in the state of New York, move to California, and you've got to start over on an entire new process. We have to create some standardization around what the guidelines are so that we're getting people in the door more quickly.
We definitely need to keep it going, otherwise we'll lose all the physicians. We have great talented physicians working in our medical group, and it would be disheartening to just lose them on in 2 or 3 years to other states.
And I will say that, you know, our politicians in Washington State, please keep going this program, you know, MDC. Please renew it.
Well, absolutely, it should be permanent. The numbers show that it is working. It's only 40. You know, we want more doctors, and 35,000 patients. It's a lot of patients. So yes, absolutely should be permanent.
Oh my God, I think our healthcare system is starving for these individuals. Starving. Not only starving in terms of the cultural language fluency that these individuals have, but the fact that these are people who have real skills and experience over years.
Now, it is also important to come up with financial solutions, not just theoretical ones. So creating an apprenticeship approach, or creating a new partnership with different providers might be
a step that would solidify the progress and secure a brighter future for international medical graduates and the communities they serve.
I've settled down in this town full of light, full of sun, quiet place, and the wind is whispering.
This journey has been one of trials and tribulations.
There's no need for any.
Honestly, it is a national security issue, the fact that we don't have enough doctors.
Marked by challenges.
And it came from this year. I don't want to cry.
Setbacks and heartbreaking losses.
SeaTac City Council member Amina Ahmed, who was killed over the weekend in a head-on collision.
Yet through every obstacle, we push forward, driven by the belief that this fight is about more than individual careers. It's a fight for justice, for service, and for a brighter future.
Tremendous talent and all it's going to do for our state. And I'm happy.
We have paved the way, but now it's up to all of us, lawmakers, communities, and supporters, to keep this path open. Join us in ensuring that qualified international medical graduates can continue to serve and strengthen our healthcare for everyone.
Falling low when you know what your aim is. It all makes sense. What you hear, yes or no, who is staying here, who will follow. Go ahead and never turn around. But still I'm searching for a better life. And still I'm not sure what it's all about. The meaning of living is still my guide. And hope is what is keeping me alive. Miles away in many roads, you've seen this life from 100 points. Sometimes it's fun, and sometimes it's sad. While searching for a better world.
Yeah, yeah, camera.
So what's the point?
Yeah.
About
international medical graduates.
No, no, the law we're passing is, look, we're saying that when a doctor, he comes here, he passes his test, and they verify, the American government verifies that he knows his knowledge, right? So the medical board, everybody says, hey, you know medicine. We agree, we believe in you.
You know medicine, we proved it.
Yeah, after that, they go through a lottery system. It's like a lottery. It's like you apply for different residency programs around the country, and there's a 50-50% that you get it, right?
Yeah, but you pick the one.
No,
or they pick you.
They pick you. So,
They pick you.
but
For him.
but
Yeah,
the problem
they pick
is
you.
the spots is not enough. There's not enough spots
Yeah.
for everybody because the residency programs is funded by the federal government, and the federal government, they haven't funded it since like for the last 30 years.
Yeah.
So what we're saying is, and that's why the shortage. That's how the shortage began in the beginning, is because the federal government couldn't pay for it. So what we're saying is, rather than this doctor who invested all his time, passing the test here, verifying his credentials, putting all that work, rather than going back to work in McDonald's, let us give him a license to work with another doctor, like do some kind of training there, and then get fully licensed.
Yeah, and that will give them an opportunity
And that will
to
give them an
earn,
opportunity.
but at the same time, get closer to the goal that they want.
So I'll be forced to work other jobs.
No, it's the same license. We're just saying we're just creating another pathway. We heading out.
Yeah.
Get out of here, man. Finally made it.
I'll try to figure this out.
Yeah.
Oh, knock myself out.